Healthcare access and affordability have always been pressing issues for seniors. But in recent years, the challenges have become even more pronounced. Rising costs, confusing insurance options, and a need for specialized care all make this topic particularly complex. However, there are ways to make it less overwhelming and more manageable. Let's break it down step by step, and I promise to sprinkle in a bit of humor along the way to make it a lighter read. The problem: why is healthcare so stressful for seniors? For seniors, healthcare is a critical part of life, but the journey to getting the right care can feel like a trip through a maze without a map or a guide. Here are the primary reasons. Rising costs. Healthcare costs seem to be climbing faster than a cat up a tree. Between prescription medications, hospital visits, and specialized treatments, bills can quickly spiral out of control. Medicare covers a lot, but there are gaps, and supplemental insurance plans, Medigap, can be pricey. Navigating Medicare, Medicaid. Medicare is supposed to be the golden ticket of health insurance for those over 65. But much like a tricky puzzle, it's hard to know which piece goes where. There are multiple parts, A, B, C, D, and each covers different things: hospitals, doctors, drugs, etc. If you're not careful, you might end up paying more than you need to. And Medicaid? It adds another layer of complexity, but can be a lifesaver for those with low incomes. Access to quality care. Even when you've figured out what's covered, finding quality care that fits into your insurance plan is another headache. And depending on where you live, specialist care might not be readily available, especially in rural areas. So you're stuck either traveling long distances or settling for whatever's closest. The need for specialized care. As we age, healthcare needs become more specialized. Seniors often require geriatric care, chronic disease management, or long-term care. Unfortunately, these services can be expensive and hard to navigate. The solutions: how to make healthcare more manageable. Now let's roll up our sleeves and dive into some actionable solutions. The good news? There are ways to simplify and improve healthcare access and affordability for seniors. It might not be as fun as bingo night, but these tips will definitely help. Number 1. Optimize Medicare coverage. Know your ABCDs. Medicare has multiple parts, and knowing how to choose the right combination can save both money and frustration. Here's a cheat sheet. Part A, hospital insurance, covers hospital stays, nursing facility care, and some home health services. Most people get this premium free. Part B, medical insurance, covers doctor visits, outpatient care, and preventative services. It has a premium, but skipping it can lead to lifelong penalties, so it's worth keeping. Part C, Medicare Advantage. Think of it like a buffet. It bundles Part A, B, and usually Part D into one plan. It's offered by private insurers and often includes perks like vision, hearing, and dental coverage. But watch out for copays. Part D, Prescription Drug Plan, covers medication costs. If you're on regular prescriptions, this is a must to avoid out-of-pocket expenses that could make your wallet cry. Solution tip: each fall during Medicare's open enrollment, October 15th to December 7th, Review your plan to see if you can switch to something more affordable. Many people stay in the same plan for years, but this is like keeping an old car when there's a newer, better model available. Number 2, consider Medigap or Medicare Advantage plans. Medicare doesn't cover everything, and copays, deductibles, and certain services can still result in hefty bills. This is where Medigap comes into play. These supplemental insurance plans help cover the costs that traditional Medicare leaves behind. However, Medicare Advantage plans can sometimes offer a better deal for some seniors. These plans are an all-in-one alternative to original Medicare and typically include extra benefits like vision, hearing, dental, and even gym memberships. Because, hey, we all want to stay young at heart. Solution tip: compare Medigap versus Medicare Advantage based on your health needs. If you're seeing a lot of doctors or need specialized care, Medigap could be better. If you're generally healthy and like the idea of extra benefits, Medicare Advantage might work. Look at your health history and future needs. Number 3, prescription drug assistance. Taming the beast. Prescription costs can feel like a bad joke. Why are a few pills more expensive than a weekend vacation? Here's how to make your medications more affordable. Generic drugs. Always ask if there's a generic version. These are significantly cheaper than brand-name drugs. Pharmacy discount programs. Large pharmacy chains like CVS or Walgreens offer discounts for seniors, so don't hesitate to ask for a senior discount. No, it's not embarrassing. Extra Help Program. Medicare offers the Extra Help Program, which can reduce your prescription costs significantly. This is income-based, but many seniors qualify and don't even know it. Solution tip: websites like GoodRx.com offer coupons that can save you up to 80% on prescription medications. Just because you have insurance doesn't mean you can't use a coupon to maximize those savings. Number 4, explore telemedicine. The doctor will see you virtually. Telemedicine became a star during the pandemic, and it's here to stay. For seniors, this can be a game changer. You can talk to your doctor from the comfort of your home, avoiding travel, long waits, and the inevitable magazines from 2012 in the waiting room. Solution tip: many Medicare plans cover telemedicine, and it's especially useful for follow-up visits, routine checkups, or managing chronic conditions. Number 5, find affordable care resources. Many communities offer low-cost or free services specifically for seniors. Community health centers provide healthcare services at a sliding scale based on income. Senior clinics. Specialized clinics focus on senior care and often work with Medicare. State health insurance assistance programs provides free counseling to help seniors understand their Medicare and insurance options. Solution tip: don't be shy about asking for financial help. Many nonprofit organizations and government programs exist to ease the burden, from helping with medical bills to providing discounted transportation to appointments. Number 6, prepare for long-term care without breaking the bank. Planning for long-term care is a bit like planning for a trip to the dentist. You know you should do it, but you'd rather not. Unfortunately, the average cost of a nursing home is astronomical, and even home care can drain savings quickly. Solution tip: consider long-term care insurance, but make sure to shop around. If you're already dealing with chronic conditions, this may not be an option, but many people can get coverage if they plan ahead. Medicaid also covers long-term care for those who qualify. Conclusion: a healthier, happier future for seniors. Healthcare access and affordability for seniors are complex, but not insurmountable challenges. By understanding Medicare, exploring supplemental plans, using discounts and programs for prescriptions, and taking advantage of telemedicine, seniors can significantly reduce the financial and emotional stress of healthcare. As they say, age is just a number, but so is that hospital bill. With the right knowledge and proactive strategies, seniors can better manage their health care without sacrificing their financial stability or peace of mind. So here's to a future where healthcare is less of a puzzle and more like a well-oiled machine. One that leaves more time for the good stuff, like spending time with family, pursuing hobbies, and maybe even picking up a new one. Golf, anyone? I'll see you again soon. Bye-bye, and thanks for reading, watching, and listening.